everyone, welcome. So before starting, just one simple house rule. As you can see, this session is recorded and will be publicly available on our YouTube and on our e-learning channel, because we want also to provide the people living with sickle cell disease with this high-value material for knowing more about today transition. So just if you are not comfortable with that, please switch off your camera. And also, as many of you know, I've asked for an informed consent because this session is recorded. So I know that some among you did not apply to, so just we are all acknowledged now that this is recorded, and please let me know if you are not comfortable. Sorry, I closed the technical parentheses, so we can start. As you know, for having a little historical background, this is the fourth edition of this patient therapeutic educational session that is organized by the ERN-EuroBloodNet and the ASCAT. Each year we ask to the participants to telling us which are the topics for the following session, and tips for transition was one of the most named topic from past edition that was held in October. So less than 1 year, not in October, sorry, in January, we are in October, less than 1 year ago. And so today we have a very well experienced panel with us for talking about transition. And I will let them maybe introduce themselves, so we'll call them in order. So first, Adrienne, if you can introduce yourself to the audience.
Hello to everybody. I'm a clinical psychologist working in France. My accent is my American accent. I've worked with sickle cell disease for a very, very long time, and I'm now presently retired, but I continue to work with associations, etc., around sickle cell disease.
Thank you very much. So then we will have a speech from Dora. If you also can present yourself, please.
Yes, I am a hematologist, medical doctor, and I worked more than 30 years in the referral center of Créteil-Henri Mondor Hospital. And now I am retired from my full-time job and involved in therapeutic patient education, TPE.
Thank you very much. Benoit?
Hi, I'm Benoit Meunier. I'm also a medical doctor. I'm an internal medicine doctor, and I work in the field of hemoglobinopathies for maybe 5-6 years. And now I'm working in the Necker Hospital in Paris, and I'm from originally from Marseille. And I was part of the one big event we had with teenagers in last August during one weekend about the transition. So I will talk about this.
Thank you very much. And as for previously edition, as you may know, we also would like to hear we want to hear from you, the patients community and people living with sickle cell disease. So we will have also some testimonies or comment. I mean, not testimony just in the sense of personal experience, but also point of view from patients. So we will have a testimony for Janaba.
Hi everyone, it's good to meet you or to see you again. I'm Janaba, I'm from France. I am a patient with sickle cell disease. I'm 37, I guess, and I have a severe form of sickle cell disease. I'm also a representative of the French Federation SOS Globi. So we have a lot of patients or parents coming to us because they have questions or they need recommendation. So I'm very happy and excited to be part of this transition conference, and I'm pretty sure we are all going to learn a lot. Thank you, Maria Angela, and thank you all of you.
Thank you very much. Then we should have our Keke. If you can unmute yourself and quickly introduce.
I think.
Hello.
Yes, you hear me?
Yes, perfectly. Thank you.
Hello, everybody. I'm a CSD patient. For a long time, I begin my adult treatment with Dora in Henri Mondor in Paris. And now with my experience, I have the formation of expert patients, and I help Dora with the ETP program of Mondor.
Thank you very much. And finally, we should have Sharon. If you can unmute yourself and present, if you are with us. Sorry, as we are in presentation
Hello.
mode. Hello, hi, you here?
Hi, sorry.
Nice to
Hello.
see you. Hello.
I know, same here. It's nice to be here again. My name is Sharon Brown Peter, and yes, I have been part of the, I've been part of this for 3 years now, but I have most of my consultations in London, in North Middlesex initially, and then I moved to King's College. So yes.
Okay, great. Thank you to everyone. Of course, everyone can participate to the conversation. So if you want to intervene, you can write in the chat or raise your hand, and I will unmute yourself. So feel at home, because as you see, we all know each other, and it's so nice to see you, all of you again. So we can start. We will learn a lot about transition. So we will have some example. We will have the opinion from an expert psychologist. So I will pass to Adrienne, our psychologist, the floor first. So she will explain to us the transition from her point of view. So Adrienne, please, the micro is to you. Thank you very much.
Thank you. Hello to everybody. Now, the transition is, before we start with Dora and Benoit talking specifically about sickle cell disease, it's a question of adolescence and our sweet little children that are no longer sweet little children, but are becoming adolescents. And I thought that you might enjoy, possibly know those living in England, the comic, we'll put a 3-minute video. Here we go. Do you see?
Before I'm 13, 29, 28, 27, boing. Can I have some more ice cream, Mum?
Kevin, you've eaten all the ice cream in the house, remember?
Oh, yeah. Duh. Bloody hell, I'm thick, Mr. Bean. Oh, no. Oh, no. 15, 14, 13. I hope it gets Super Mario Kart. Boom, bam, bam, boom, bam, bam, boom, bam, bam. I don't have to go to bed tonight, do I?
Yes, in 5 minutes. Remember, you've still got school tomorrow.
Oh, yeah. Duh, Brian. Yeah, I'm 13.
Happy birthday, Kevin.
Happy birthday to me! Happy birthday to me! Happy birthday, Dick! Go! Go!
Kevin?
Go!
Are you all right?
Darling, he's losing the power of rational thought.
And the use of his arms.
He's become a teenager.
Kevin!
What?
It's your birthday, Kevin.
I know!
Happy birthday, Kevin!
Okay, stop going on about it, will you? Why isn't there bloody ice cream?
Oh, come on, Kevin. You've eaten 5 tubs on your own this evening, remember?
So unfair, I hate you!
Kevin, don't speak to your mum and I like that.
What? I didn't say anything! What?
No, Kevin, that is for the morning.
I can't do anything anymore!
Oh, well, seeing as you've started, at least it'll cheer him up.
Oh,
said you wanted Super Mario Kart.
I hate Super Mario. It's sad. I want a bloody high five.
Right, that's it. Off to bed.
I am not going to bed. I'm going out.
Oh, don't be so stupid, Kevin. You can't go out now.
Why not?
Because it's 12 o'clock, it's way past your bedtime, it's pouring with rain outside, it's dangerous for the child on his own, you've got nowhere to go, and you've got school tomorrow.
That is so unfair. I hate you. All right then, I will go to bed, okay? Happy?
Good night, Kevin.
Don't bloody shout at me!
Don't worry, darling. It's only a phase. It only lasts for 4 or 5 years.
Okay. So it's a bit of a caricature, but all the points that can be difficult with living with a teenage child. There's the references. We see the difficulties of setting limits, of the child who is no longer a child.
Sorry, Adrian, to interrupt you.
Yes.
Could you put the slide in presentation mode so we can?
Right.
It's
right.
just
Excuse me.
at the bottom on the very right.
Yes,
You have the symbol.
There we
Oh,
go.
yes, great. Thank you. Sorry for interrupt.
No, that's nice. So the transition is for all children going from childhood, adolescence, and adulthood. And the sickle cell will be added on top. Transition means a change from one type or one form to another. It's the process by which this happens. Something changes from one situation to another. So for all of the children that have sickle cell, they will be going from childhood to adulthood and passing by this transition in adolescence. They're no longer a child, and we see that the Kevin has a lot of difficulty having to confront adult behavior, not yet adult. And then in addition, there's all the hormone and puberty changes that the child needs to deal with, and the parents as well. The question of transition is inherent to the physical and psychological transformations of all adolescents, not just sickle cell disease. So there's adolescence is the physical and emotional changes that happen when becoming an adult. Teenager, the famous teenager, is an unusual invention that came up in the 20th century. Before it was the physical adolescence, and nobody made a fuss about turning 13. It was only after the Second World War that becoming a teenager started to be something special, and attention paid to being a teenager and no longer a child. And increasingly, we see now there's sometimes a teenage medical health center where the children don't go directly from pediatrics to adult, but pass through special adolescent care, especially when it's chronic illness, but not everywhere. Adolescence comes from the word to grow, which means someone who is in the process of growing. And the same role, the root adultus, means someone who stopped growing. I think that's a little exaggerated because we continue to grow. And the adolescence is really marked by the biological phenomenon of puberty. Adolescence is a global process unique to the human race. The adolescence is marked by the beginning of the puberty, and the end is when an adult has reached sexual maturity and is capable of reproduction. The World Health Organization describes adolescence as a stage from 10 to 19, which is a very long time. And we see today that many adolescents are still adolescent, even 30, or they say delayed adolescence. And this transitional state was very first described by a psychologist, Erik Erikson. He was a German-American psychologist, and he was the first person who spoke about life crises, introduced the concept of crises, which is a description of the internal conflicts that are involved when we develop. And according to Erickson, the first crisis occurs in early to mid-adolescence when there's identity confusion and an identity crisis. And all our children are struggling with their new identity, their physical identity, their social identity, their psychological identity. And living with a chronic disease from birth, and most specifically sickle cell disease, represents a huge stumbling block in the process of this identity construction, because they have not only to deal with their physical changes, their social changes, but they have the sickle cell disease also to deal with. During this time, the children will all achieve sexual maturity. Sometimes with sickle cell disease, it's a bit delayed. They need to find their integration into a peer group. Friends are extremely important. They need to work towards autonomy and independence. This identity that they're acquiring englobes their self-esteem, and with clearly identified projects and plans for the future, which can be difficult for the children and also for the parents that often live with an idea that their children may not make it through adulthood because of the high death rate in the part of the world where there's no proper health care. Transition for the parents is often even more difficult for the children because they have to let go. They worry, and they have to deal with these worries, and they have to be able to place their confidence in their children's capacity to be independent and autonomous. The issues that are related to the transition from the pediatric unit to the adult unit are their relationship with their pediatrician is no longer possible. Their need for educational programs adapted to sickle cell and to adolescents, which are not always available. There's not always access to proper health care, and all the psychosocial problems that they have to deal with, the overprotection of the parents, their anxiety, their emotional dependence, and often a feeling of exclusion, and sometimes putting themselves at risk to prove to themselves that they are not bound by the sickle cell disease. Transition also means that they have to move on to adult unit and adult emergency care when arriving at the hospital. And everyone who has gone to an adult emergency care knows that it's not always an easy step. It has nothing like going into pediatric emergency. When they're in crisis, they need pain medication and are often confronted with an underestimation of the degree of pain, and they're suspected of being drug addicts, which is not the case. There's some very interesting studies that show that the healthcare workers have a difficult time when they're faced with great pain of the people coming to consult. So they systematically underestimate the pain, which has nothing to do personally with the patients that are coming to the emergency unit. And that's all. Thank you for your attention. It's a very brief overview of transition is not just limited to sickle cell, but it's a process that everybody has to go through and difficult for everybody.
Thank you very much. So we can, unless there are no question or comment on that, we can also interrupt every now and then the presentation. I see no hands raised and no comment in the chat, so I think we can pass to the other presentation, and then we will have to talk at the end. So please, Dora, the floor is yours now.
Thank you, Adrienne. So I will go further. From a clinical point, what is transition? You can.
Sorry, Dora, I have this moderator role. Yes, please. Thank you. Thank you. Sorry for that. I'm very annoying today. Thank you.
So it's okay. So transition for all chronic diseases is a purposeful, planned process with a goal of providing continuity of care and preparing young adults for greater independence. So medical, psychosocial, and educational needs. The lifespan of patients with sickle cell disease continues to increase. Virtually all affected individuals in Europe reach adulthood. However, adolescents and young adults, AYA, with sickle cell disease are at risk for serious complications during their transition from pediatric to adult care. Here you see the curves, mortality curves, and the black one is 1979. So there is a peak in early childhood due to infection, septicemia, and now with neonatal screening, antibiotic prophylaxis, vaccines, and transcranial Doppler, this peak is nearly to zero in the red line, and red line is 2017 in US. So you see that there is still a peak in mortality among young adults with sickle cell disease. The red one is, sorry, the red one is 2017. There is still this peak. We all know that vaso-occlusive crisis and acute chest syndromes, paraplegism are only the top of the iceberg, and there are complications in many organs are cumulative and adding to other age-related non-sickle conditions. For example, asthma. We know that asthma is a bad condition with sickle cell disease. It increases the risk of acute chest syndrome. So these complications are really common in adults, and if there is no detection of this complication, it may be a problem. So we know that there is a risk of serious complication during the transition. For example, it was shown that patients on transfusion program for stroke or cerebral vasculopathy, anomalies of abnormalities of transcranial Doppler, high risk of stroke and or death if stopping transfusion during this transition. And there is in AYA, high acute care utilization rates, emergency department visits, hospitalization and re-hospitalization. In the same time, rates of outpatient clinics decrease. Pain becomes chronic. This is very a problem in young adults. 30% of young adults with sickle cell disease experience pain 25% of days, which is very intolerable. Anxiety and depression are additional barriers that affect transition process and concern more than 30% of adolescents and young adults. Patients with SC or S-beta plus thalassemia who are less symptomatic are at risk of specific complications if the follow-up stops, if lost in transition, retinopathy, and they may experience retinal hemorrhage at age 25 or 30 if they were not follow-up. So this is the transition practice. For sickle cell disease, 2011. Fortunately, in France, we have not the problem of financial bias, which exists in the US. But the follow-up, the insurance coverage is different in adolescents, young adults, And so it's important to know that. The other I will pass through because I want to leave time for testimonies. And so what I'll say, poor self-management skills and low patient engagement, lack of trust in future providers. Pediatricians are very close to the children and also families, and it's really a problem to go with a new provider and a new emergency department with old people, and it's very a fear of this young adults. What is the situation concerning transition in France? There is a transition group with resource expert patients within the filière MCGRE, which is the network of all sickle cell disease, thalassemia, and other rare anemias. Creation of pedagogical tools to promote the improvement of skills. Workshop led by caregivers in the respective hospital and resource patients in pediatric departments. And the title of the workshop is To Become Adult with Sickle Cell Disease. Despite these efforts, there is a great disparity according to the centers. This concerns the reception in the emergency department and non-information about transition process and identification of the referring physician caring for adults may occur. This is a kit for transition for physicians, but also caregivers, and also there is one for the patient. But if he is alone to deal with it, it's complicated. And so every outpatient clinic in pediatric from 12 years, and you have to speak with adolescents and tell that transition will go on, and he will go to the adult department. Often patients, what Adrienne told, are not taken seriously given the lack of knowledge of adult emergency doctors about sickle cell disease. And there is really an emergency crisis situation in France, particularly in the peripheral hospitals of Île-de-France, with interim doctors or in regions where few SCD patients live. Failed transition is trust in caregivers reduced and possibly conflict with parents. So the sickle recommendation was published. It was published by Baba Inusa, who is a pediatrician of UK, and so it's skills transfer, increasing self-efficacy, coordination of transition, knowledge transfer, linking to adult services, evaluating readiness. And so just to present EVAD is an association dedicated to therapeutic patient education, and its TPE is in France a right of a patient, and is also in the health law. And so you see that 12 hospitals are involved in Parisian area. So I am finished. I thank you for your attention, and I am glad to hear the testimonies of patients. Thank you.
Thank you very much. So if we follow our plan before the debate among all of us, there should be Benoit now.
Hello again. Can you put the slides about the ADEA weekend?
Do you have that, or
I think it's at the end of yours. No?
Yes, but again,
and
okay.
I can't.
It's okay. It's okay.
Yeah, it's here.
Okay, and up. This is. It's okay. You see it?
Yeah. So EVAD, the association of Dora that Dora was talking about, organized for the first time in 2021 the first transition weekend, which I didn't participate. So I can't really talk about it, but from the feedback I had was very successful, and to this year in 2022 they renewed this experience with other teenagers, and also these weekends were organized with patients associations, which are Drepacare, SOS Globi, Cyclelink, which are the biggest patient associations in France, to help in the organization, to recruit the patients, and to recruit the adults experts that were taking part of the team of how do you say, animators. So we were a team of so I'm gonna talk now about this weekend I took part this year. So it was 3 days. From Friday afternoon, we met the kids at noon on Friday in Gare de Lyon's train station in Paris, and some kids went by car, and we met at some sports center, which was held by a French army. It's a very nice place in Fontainebleau, next to Paris, where sports, how do you say, where the for example, a professional sports men, they train for Olympic Games and stuff like this. So it's very nice place and very safe also, because it was all surrounded with security and stuff. So we met the kids there, and we had a program during the 3 days from Friday noon to Sunday afternoon. So this weekend we organized, thanks to EVAD, who organized trainings for caregivers and patients experts to be during the months. I don't remember exactly, but it was in April, and then May, June, and July. We had different sessions to get trained to the techniques that we use for education, the patients' education. And we get to prepare the sessions for this weekend. So at the end, we gathered doctors, nurses, adults, SCD experts. We had a dietitian that came for one specific activity. And we also had 2 musicotherapists. One of them was also a general practitioner, to make this specific activity on music. So all of this was a big preparation. The objective we gave us and we gave to the kids was that they get to know each other. So it was the same for the kids in between and the kids and the team of adults. I don't know how to say, but we were so we had to know each other, to learn from each other, exchange exchange experiences of life, get examples for other adults. So that was for the teenagers to meet older sickle cell patients, carriers, and to have examples of people who are working, who are integrated in the society, to have positive feedback of it can be a good experience to get old, even if you are sick. It was also the feel normal in a group of peers. So that means that if you are sharing a moment with other teenagers who have the same disease as you have, you can be you can feel normal because everybody has the same disease, so you're not different from other teenagers. So the only difference is what you're talking about, your opinion and things, but it's not, you don't talk about, it's not to take in consideration between them. Empower them, so give them the capacity of being more autonomous, and of course to have fun, because it had to be the purpose was not to be like at school to listen to professors, but to have exchanges and to learn together. So now I'm gonna just talk about the different activities that we have during the weekend, which was very quite big, but we managed at the end to have all the activities, and we managed to save some free times. So the first day was dedicated to ice-breaking games and team building sessions. So it was basically, so they didn't know each other, the teenagers, so they can be shy, and you have to create some cohesion in the group to learn the names of each other's, and so this worked quite very fast. The kids became very friendly to each other. So that's it. And after the dinner, the first day, we had an empowerment session. We asked them the questions about what will change for them. They had to think about it and what are their fears and their resources for the transition. On the Saturday morning, we had some physical activity sessions. So you know now that in the sickle cell disease, the message that we want to give to the patients is that physical activity or sport is something that is very important, that can improve their state of health. And we want to change the idea that they can't do sport, which some of them still believe. So first we had some orienteering race or trail game. So they had a cross in the park to find some papers, and they had some questions, and there were some games to do on the path. And at the end, and they had to run or walk. And at the end, we had I think a walk about 1.5 hours. And then we had a feedback on the room, and we talked about what is physical education, physical activity, how they were feeling about it, and how they could implement this in their daily life. In the afternoon, we had the music therapy session, which was a way to learn techniques to relax, for example, or to control emotions, which was a real success. It's one of the sessions they liked most, so it was very interesting. We had a testimony from a nurse who works in a hospital in Congo, and she's taking care there for patients about sickle cell who had sickle cell disease, and she was in France for training for herself about the patients' education, and she integrated our group, and we thought it was interesting to open the discussion about sickle cell disease in Africa, because they all have roots from Africa. They are really interested also in their roots and to know how things are going there. So the discussion was really nice also about it. Then we had a dietary workshop with the dietitian. So first we talked about hydration, what to eat or not to eat, which is basically the same as in real life, but also what to eat when you are in hospital, when you have nausea, or when you have constipation because of morphine, for example. So we had these little tips about what can be about how to eat with sickle cell disease. So we had a chat about it, and then they cooked with the dietitian. So it was some also team building activity to manipulate the vegetables, and to work together to create something for the group. And then they organized the Saturday night was dedicated to a party, and we let them to decide what they wanted to do. So they had some game cards, role play game card, which was called Loup-Garou in France, which was really funny, and they danced. And on the Sunday morning, we had the sickle cell sex bingo, which is an activity to talk on a fun way about sexual and reproductive health in relation to sickle cell disease. And for us, it was really important. And it was also feedback from the previous year that they had questions about these issues. So this worked also quite well. And even shy kids participated. And we finished by the role-playing sketches, which was, we gave them a situation of real life, for example, in a hospital or with friends or with family, to play, to act in front of the other kids, to then have an open discussion about this one issue or another, which was also very funny because they acted really fun. So everybody was laughing, and it was for us a good way to bring discussions about issues. And also what was really important for us was that they have free time to just chat with each other and get to know each other. And most of the free time was at night because they went to bed very late or early in the morning. I don't know how to say, but at the end they were really happy, and I think that the objectives were fulfilled for us. We had some evaluations forms that they did, and we had very good feedback. So, and here are some pictures of the group. Voilà. Thank you. And I hope so. So it was only 15 patients this year, but I think they created a group. They are now keeping in touch with each other. We will meet them again, the same group, during winter to see what is the evolution now in their lives, and to have also a feedback from them a few months after the weekend. And we hope that we will be able to make it again every year for Parisian region. And I have the project that we would also make the same kind of weekend in the other parts of France, maybe with groups of cities, for example, cities from the south or cities from the north, etc. Thank you.
Thank you very much. So we can pass now to patient's voice. So Diana, maybe you can go first, as you prefer. We don't have.
If it's fine for everyone, I can start. I'm so sorry I don't have any slides. I'm just going to talk.
Those are not mandatory.
All right.
Worry, it's fine.
Thank you. Yeah, I'll be happy to share my experience on transition. I'm so sorry it took place like 17 years ago, so it's been quite a long time. I still remember it because when I remember transition, I live in Marseille, by the way, in the south of France. It's not great memories because we had transition in my hospital, La Timone, in Marseille, when I was 20. So I was not really a teenager, but still I was very young. And as all of the presentations earlier showed, a transition is not only for patients, it's for everyone. And for me, it is a moment when I realized that I had sickle cell disease, that it will have an impact on everything in my life. And before that, I was kind of acting like a kid. Like I was in pain. When I was in pain, I was in pain. And when I was not in pain, everything was normal. So I did not realize very young what sickle cell disease was. So I realized also that sickle cell disease impacted every patient that I knew when I was young. And a lot of patients some patients got lost in the process, and some patients, just like me, got more and more symptoms and complications. So before 20, I had crisis, but not that much. I was able to go to college and everything. And when the transition took place is when I realized that it will have an impact on my studies. So it took me more time than other people to get my degree and my master's degree. It will have an impact on my relationships. And before that, I did not realize it would have an impact on the countries where I wanted to live, because I had this big ambition where I would go to South America or Africa and live there like forever without thinking about my medication or the blood exchanges. So I think that at this moment, I would have needed more follow-up, and especially psychological help, because it's very complicated for someone to realize that the life you have been imagining will not be the one that you will have, not because of you, not because you will not be able to make it, but before of this bloody disease. So it took me like years and years to realize that I will have to cope with it and I will have to change my plans. So that's why it's been complicated. And then for everything that's outside of my person, I remember my first time I went to the adult ER. I mean, I don't know if it's the same about all the patients, but me, I don't like when things change, when it's about my, let's say, medical staff. I hate it. So every time I change specialist, it's very hard for me to cope with it. So you end up with a doctor you don't really know, which was very nice. It's not the problem. But nurses you don't know, who don't really know about sickle cell disease. And when you go to the ER and you tell them that you are in a pain, you're 20, you look fine because no one can see that you have a disease, and you ask for morphine, it's really complicated because they tell you that you are like acting in a weird way because they don't know the disease. So I'm very happy myself to see that things have changed in 20 years, even though we still feel like we have to push as patient organizations more. But the fact that we hear testimonies from kids or young adults, from healthcare professionals, from parents, saying that things have been set up for the transition is a good thing. It is positive, but still we feel like it's not enough for the patients, because when you are a patient, you want to have everything right now, and it makes sense because when it comes to health, you don't want to wait. And I heard about the Adult Rep weekend, which was a great initiative, and SOS Global was part of it as well. But we also had a weekend in France for patients in Paris or the Parisian area, and also from other cities that took place in April. And we had very good feedback from the patients. And I remember one quote from a kid, a teenager that was 16, and he told us, I was in a pain and I was feeling tired, and I did not need to talk a lot because I was with patients who understood my pain. So it's great to feel understood. So I feel like this kind of initiative should be done everywhere. And I'm pretty sure that with the whole team that is here, it is possible. Thank you very much.
Thank you very much. So maybe Sharon or Awa, as you prefer. I'm randomly picking the testimonies, so as you wish.
Yes. I just want to relieve what Janaba said. It will be important to begin the transition process with doctors, with caregivers. I think that in the mid-adolescent, it will be more efficient to begin the process of transition. To arrive to 20, like Janaba said, it's too late. It's too much change, not medical change, but psychological change. She said, you realize that your life will not be what you hope. It's too late to know that at 20. It will be necessary to begin the process of transition in mid-adolescence.
Thank you very much. And indeed, those are key crucial concepts we can maybe then explore all together. Thank you to both of you for the testimonies. I can imagine how challenging it is to share when it comes to personal experience. So thank you very much. So Sharon, would you go with your testimonies? Or maybe she's not. I can't see to unmute. Maybe I can help you. Maybe
Hi,
now?
hello.
Yes, hi, hello.
Hi, sorry. I just wanted to make mine quite quick. I can't exactly remember the age I transitioned, but I'm 26 now. But what I do remember is starting school in secondary school around the same time, and I just remember that being quite a hard transition for me. So I do think that's something to take into consideration, because I knew I was falling sick quite often around that time, and because I was trying to adjust to my new school. It wasn't the school I was expecting to go to as well. So I, with a setback and then trying to adjust, advocating for myself with the doctors and all was quite difficult for me. But I would say, like, at that young age, school takes up most of our minds, and it does affect, like, it affects our, like, how depressed or how anxious we are about what we would and what we're going through around that time. Also, yeah, I do agree with the points made previously, that when we're transitioning, to take into consideration the age is also equally important. Like, if we're just, like, getting into starting a new phase in our lives and becoming adult teenagers and all, like, it may be beneficial to just take some time before we can now start going to the doctor and sharing our problems, sharing what's wrong, especially during GP appointments and all. I don't know if I'm making sense, but just taking it in phases can be quite important. I'm not exactly sure what age now the transition happens. Does any hello? Oh, I was asking, I'm not sure what age the actual transition happens now. Or
well, I will let maybe the Adrienne or Dora answering to this question.
I think before Dora, there's no one age for transition. I think the pediatricians tend to follow the child and see where his maturity is and if he's ready to start to think about leaving pediatrics and is puberty started or not, and introduce him in his mind, talk about going on to adult without the transitioning, which seems as it's not one moment, but a continuing process.
Okay, because I just remember when I had signs or indications that my period was about to start, and that was when I was considered to transition. But at that young age, I don't think I was able to articulate how much I was going through at that time. But I know I was starting a new school, I was moving to a new area, there was so much going on, and it can add to the anxiety and the depression, which can cause more crisis and so on and so forth. So I think further down the line, I even had to have I was misdiagnosed. So I had a high bilirubin count, which eventually caused my gallbladder to have stones, or I'm not sure which one came after the other, but I was completely yellow at some point at maybe 14. And then, I had a very bad crisis. Then they found out I had gallstones. Then I had to have the surgery. So I just remember my adolescent time, my teenage times being so tumultuous. And but one thing I did learn is how to advocate for myself. So how my mom did that is by so when she would come to the meetings with me, or sorry, the GP appointments with me with the doctor, she always took note of everything. She had this notebook that she gave to me eventually, and she used that to document everything the doctor said. And we had our own kind of code, just to know, oh, this is what my hemoglobin was, HB, this is what my my pulse was, so on and so forth, so that I had an idea of what my stable state was, what my what my sickle state was, and so on and so forth. And I think that's a skill that a lot of people with sickle cell that I meet today do not have. Knowing it's interesting to know that a lot of my friends don't know what their stable state is. So I think that's what was kind of key for me. And then when I started going to my appointments alone, I started documenting. So yeah, I think that's important, because it's not just the doctors that will document what's going on, also the patient has to know as well. So yeah, developing that skill is so important. So that's all I really have to say.
Thank you very much for sharing your point of view. I will address some comments that have been written in the chat, and saying so, I said before, feel free to take the floor. This is really a common session for all of us. So we have a comment say, I can also suggest that counseling is important at the time of transition. Then another comment from Constantine saying about when transition starts, saying that in Sweden is 18 years old. Then we have a comment from Laura in Ireland, is 16-year-old as per government healthcare guidelines, but consideration is given to other factors such as treatment option, state of patient's severity, and so on. Then another comment from Jenna, we are also lucky enough to have younger generations who went through transition and are willing to teach their experience and tip. I guess coming from a patient, it makes the communication easier. Indeed, this is a very important point, and it's also one of the points I would like to discuss all together, because well, I don't think, maybe I'm wrong, I hope to be wrong, but I think among us we are all adults. I don't know if there are any teenager with us, but it would be nice, for instance, for next year, if we can maybe organize with adult patients a program for teenagers altogether, maybe with the starting points we could identify and raise today. But before arriving into the discussion, I know we have already many input and feedbacks we would like to further explore together. I would like to give the floor to Desio, if you are still okay in sharing also your testimony with us.
Hello, everybody.
Hello.
Now, a lot was shared here today. Jenny told us a very good part of what it is to be a young sickle cell patient and then turn a whole adult sickle cell patient. Here in Portugal is where I live. It's a little bit different. We have a support system in pediatric care that allows us to be more comfortable with ourselves and acknowledging all the changes that we are facing, crisis, body changes, first period or whatever, you know, and that goes until the 7th to the 18th birthday is when you make the change from the pediatric hospital to a normal hospital. And in pediatric, you already know everybody. You know the nurses, you know the doctors, you know the caregivers, you know everybody. So it's like closing your eyes and open in something total new, where people don't understand where you come from, are not willing to understand where you come from because they are all busy when you come to the ER. And by that, it makes us shut down even more as patients. So we have a lot of problems, and we react to our disease, some very similar, but in another way. So by then, when we are 18 or 19, coming to the 20, our body is so used to the mutation that what they give you in the hospital to contain your sickle cell crisis, it's not enough anymore. So you gotta be able to take more and more doses and more strong doses as well. And in adults, they don't understand that part, and they see us as some drug seekers at some point. And sickle cell is not that informed or good informed among the young sickle cell, the young doctors, the young nurses that we come along across every ER that we go to. So for me personally, my transition was like I was 15 when my parents moved to the Netherlands. So I had to learn a new language to adapt myself and communicate how I feel, how things are going. Good thing that the Netherlands have is that they really rely on that multidisciplinary team. That's something that I want to bring up, because that's something that I really believe that will help the younger making the transition to adults, and also the adults making the transition to the next phase, the adult phase that we don't know yet. It's something that we need to talk about. So I was in the Netherlands, so I got to explain where I came from. They made the new study, and they came up that I had sickle cell and thalassemia, and I was very good handled. I think I was not a normal sickle cell patient because I really did a lot of sports outdoors. I did basketball, and I had a special pass for the league that allows me, when I had a crisis, to go to the hospital and I could get the medicine, that the opioids that were not allowed in sports. So by the time that I got injured in my back was the time that the doctor said that was done for me for basketball, so I couldn't play no more, and that was my reality check. And I started to learn from the beginning what it is to be a sickle cell patient, because you can talk to another sickle cell patient and he can relate to it, but he also has she also has their own opinion and their own journey, right? So we can only learn from ourselves, from our experiences. Is that what I think? By sharing my experience to younger sickle cell patients, I can give the empowerment and the hope that I needed back then. Then that empowerment and strength that I searched so much, and I got to create this inner persona in myself to be allowed to give that, because we have a lot of psychological issues. Our parents, some of our parents neglect that the possibility of having a sickle cell baby. They don't understand how hard it is to follow up with the growing of that baby and the need that they have. The first time that they have crisis, what should I do? Where should I take my baby? For me, they discovered, I think I was 2, but they brought me to this medical doctor, a general medical doctor, that always told me that I had some amygdalitis. Is that correct? What I'm saying?
Yes.
Because I had a lot of kill pain and my back hurts a lot, and a lot of X-rays didn't show up the variety of the points that were damaged back then. So he gave me a lot of antibiotics, who gave me the
Yes.
yeah, who gave me the the ability to process a lot of process that amygdalitis that I should usually had, and then turn that in something else. So the crisis that I have from 4 years old to 8 years old, something like that, was when I was diagnosed with sickle cell in Lisbon by another hospital, a great hospital, that has a lot of good professionals and nurses. That's the pediatric hospital of I don't know if Miriam is there. She can help me.
Right.
Sorry?
You need something? I am here. You need something?
Yes. What they call the pediatric
Estefania.
yes, Hospital Dona Estefania.
Yeah, in the Lisbon area. It's
In the
specific
Lisbon
for
area,
children.
yes. That's the best hospital for children, I think. For sickle cell patients, even better. So when I was there, I was feeling safe because everybody knew what I was going on to, what were my struggles, and in that period, as a child, when you're growing up, you're starting to understand what is funny to say and not so funny to say. So in that hospital, they have that care, and that touch of saying to patients really what things is about, without you knowing that that's too bad. So when I moved to the Netherlands, was when I was faced with this big change reality. They have multidisciplinary teams. That's okay, but most of them hospitals don't know nothing about sickle cell. However, sickle cell is a disease that is always brought from Curaçao and other countries where the Netherlands used to go historically. Suriname as well. So they had sickle cell in some hospitals, and the guidance for sickle cell patients were directly sent to those hospitals, because those hospitals had the doctors that knew how to take care of a sickle cell patient. I didn't have that chance to go to those hospitals. I can complain for my doctor that when I arrived and he followed me up, because he did whatever he could to understand the disease and giving me all the ways to help me in that transition. So I have no negative things to say to them. I only wish that this we started to talk about multidisciplinary teams in a few years ago, I think. I mastered myself in physical therapy, and I did 2 years of medical board in a medical school. But I only seen that helping each other in so many different areas about 5 years ago, I think. And that's what is important for every patient, not only sickle cell patients, is that the help in the transition and the good information given not only to the patients, but especially to the families, that the families are the ones who are going to take care of that patient when that patient goes home. Creating ways that the parents should not have to leave their jobs to take care of those children, because that's what happened, especially here in Portugal. And if that happens, we turn like we're spinning another 180 in this whole phase.
I'm sorry.
Yes.
I've tried to raise my hands, but I guess we do not see on the screen. Yeah, I mean, your experience is very important. I'm not gonna say very interesting because obviously it's been painful. The thing is that we are lucky enough to have enough healthcare professionals and patients, and we know now that transition has changed from, I mean, for example, 20 years ago when I got my transition to now, but still we have a lot of things to do to make the things better. So maybe everyone can share their thoughts, their feedback, giving information to make sure at a European level, it's not only about Portugal or Ireland, France, Spain, whatever. What are the good options that have been done earlier that we can reproduce in other countries? And if anyone has like feedback and good ideas, it would be great to share.
Yes, that's what I was about to say. That multidisciplinary team that I found out in the Netherlands when I was there is so good to recreate in other countries, so that we as patients don't suffer that much with the transition. You know what I mean? Especially the psychologists, especially the psychiatrists, especially the physical therapists, especially the nurses, and then the doctors, but the patients as well gotta have a voice in this. Because if you don't have a voice in this, we are just creating a program for, you know what I mean? A robot program without having no knowledge if that works with sickle cell patients. I know that we are very different in some kind of ways. We raised up different, we react different, our crises are different, but the main concern is there. And with the help of these caregivers, with the help of this multidisciplinary team, we can for sure minimize and help sickle cell patients throughout the transitions that they have every day. For instance, you have a crisis, or I have a crisis. I know that when I'm gone from the hospital, I have some days in my house that I'm going to suffer there, because I have to make the transition from the hospital to the house, and to the house to my active daily activities. You know, here is where your psychologist and your physical therapist come in and help you in that transition, like beginning out to move again properly, gaining strength in your body so that you can move properly, understanding what you are being going through, your dark phases, your dark emotions. You don't need to hide those and make yourself like a bigger and stronger Desu or Jenny. You know what I mean? So
thank you very much, Tesio.
that's what about that's all about it. Thank you,
yes,
everybody.
that's a very comprehensive point of view. I want to ask to all the audience, and of course, if any of you want to share their experience, please skip my question or integrate my question in your experience. So I think that one of the point that is difficult in transition, maybe I'm wrong, it's just an idea from an observer point of view, is how to develop the assertiveness, which is also complicated for adults to have. So how to being able to have this authoritarian voice on his or her own life. I think in teenagerhood is more complicated because well, there is a lack of experience to how to raise our own needs, our own thoughts, our own sensation. We don't know precisely how to codify them in an external world that could be parents, how to handle the disease according to parents' wish, or doctors' suggestions. Or, for instance, I remember the testimony from a patient moving from a pediatric hospital for receiving transfusion to an adult. This patient was unable just to explain to the nurse which was the arm she would prefer to have transfusion, which looks like a simple things to express, but when you don't know how to build your own voice, this is quite complicated. So I would like to know, maybe from Adrienne first, as she's a psychologist, if she has some tips, as today the session is tips, and then everyone, if you want to share suggestion for young or young adults. So Adrienne, and then Nell, and then all the other people that want. So first, Adrienne, thank you very much.
I think making your voice heard is extremely difficult. And just to talk about it from the time the children are very young and talk to the children during, not that they have their own voice in the pediatric consultation, that it doesn't pass over their head between the doctor and the parents, but the child is included and asked what he thinks, how does he feel. So the children start very young, being used to saying what they have to feel and how they want to get the message passed. What Decio said about multi-team is important, because when you go to emergency and the nurses are overworked and the doctors are overworked and they don't take into consideration what someone is saying, it's very difficult to be heard and say, I want the right arm, because they've already put the needle in the left arm without taking the time to hear or to ask. So
thank you, Adrienne. So Nell, you
Hi,
can unmute
everyone.
yourself and take the floor. Yeah, thank you.
So I would like to answer to your question, but also give my testimony about what everyone said. So for your question, I never really had a problem about being assertive with what I feel and what I want for my health, because the thing with SCD is that you live with it since birth, so you know what you feel. You think a lot about what can endanger your health, what can make it better. So it is true that when you're conflicted with with your parents, with your friends, the medical staff, like the doctors, nurse, and whatever, you tend to to be okay with most of what they said, even if you're not really okay with it, or you're taking the time to process what they're saying, if it really can make you better. And it is in that period that I think you build most of your assertiveness. Yeah.
Thank you very much. Do you want to continue?
If I continue, it will be most about my testimony, because like most of everything that has been said, I felt it a lot, like the addiction stigma. When I was younger, I'm 25, but when I was younger, like 15 or whatever, I thought that it was related to my department, to my territory. But when I grew up and I was talking with a lot of people who have FCD, who's living in UK, for example, or America, I realized that everyone feel the same thing. It's not related to any territory or another. Most or some people from those staff think that you come here in the urgence, yes, to find medication because you want it, not because you need it. And it's something that we really need, like a morphine. It's one of the things that can appease the crisis, and sometimes you need to really put a lot of morphine to find appeasement from the crisis. And there's a lot of staff that don't understand that. For them, it's like it's magic. You will take a little bit of morphine, it will be okay. You can go back to home or whatever. And the reality is really far from it. And that's it.
Thank you very much. Miriam?
Hello.
Hello.
It's nice to be here again and to see some familiar faces. It's a difficult topic, and I'm 54, so my transition was a long time ago. And I can say that at the time, well, at least I don't remember the experience of the pediatrics as it is today, very focused on unless it was for babies. So for a little bit older children, I don't remember that, but I would have treatment at home many times. But I remember when I was 10, 12, probably, so turning into adolescence, and later a little bit, that my hematologist one day asked my mother, so I was very reliant on my mother when I would go to the appointments. She would do all the conversation, she would know everything, and I would just sit there quiet. And one day the hematologist asked for my mother to go out, and he explained that I want to talk to her because she needs to own the fact that she is a chronic patient. She needs to start knowing about it without the presence of an adult, because she will need it at some point. And I want to start, I want her to become independent gradually, because you won't be around every time, or the father, or the sisters and brothers and everything. And in England, because he had done the PhD in England, I have many pediatric patients that know the basic stuff and know what is the medication and a lot of stuff. So it's about time for her to know that. That was a really important lesson. And I think it was Sharon that said before that she gradually started going to appointments and taking a notepad and taking notes and knowing the basic stuff. That is a very good thing. It's for the patients also not to rely so much on the family members that they go with, but they also start understanding about the disease, knowing the basic information, and learning to explain themselves. Because one of the things that I have noticed is that if you can articulate and speak as if you know something about it, about how the disease affects you, usually the healthcare providers look at you in a different way. So the thing about being assertive is a little bit difficult. It has to do with your nature as well. And examples of situations where no matter how much you say that I know that in my case medication doesn't work and it's another one that works, or that this arm is better than the other, they simply ignore you. And I'm 54, and this happened this year when I was in hospital for surgery. So it doesn't have to do with your age. It's just you have to be a little bit lucky with the people that you meet. But you also need to say that at least you should try. And if you can explain in a, I'm going to say humble way, but it's like you simply explain that, look, I am the patient, I am in pain. If you could please listen to me. And that is one of the points that really needs to be worked, is communication and the healthcare professionals listening to the patients, and the other way around, because many times that is where it fails. So we have already talked about the multidisciplinary teams. That is very important. One of the things that for example, I had here in the UK for the first time, but I think that in Portugal they already do it, but I had to ask for it, was to have the hematologist come up with a pain medication plan and put it in my file in the system and explain to me, if you go to the emergency and they don't know where to look for it, you can say that it's here. And he did that with working on a pain medication plan based on my profile, okay? So the amounts that I could take in an emergency case or regularly, or all that, because that is important information. You should have it, you should work on that when you are okay to prepare for an emergency, because emergency is always complex and you never know where you will end up. So if you can take note of that as well. And today we all have mobiles. So if you can take a picture, have a, like, ask the doctor to send you in a letter so that you have the letter or something. Sometimes that helps, not always, but that also helps. It's difficult. I remember that my transition into adulthood, I was 14. I had a problem with a membrane that involves the heart, and I was admitted to hospital, and I was put into the adult women infirmary or wards because I was 14, and that was the date or the year range when you would move from pediatrics to adults. And it was tough because it's a whole different, even the way that people behave, conversations, everything is completely different. So it's not just about the care, it's a number of things which is different. So it is very important, the communication, the dialogue, the teams, that you gradually learn to express yourself and to know what your situation is. But I think that we are much, much better today, 40 years on, especially in the big cities. In the smaller cities where no one heard about sickle cell, it's more difficult. But if you can build your own folder with the basic information, that helps.
Thank you so much, Miriam. So I see, Jenna, you have your hand raised, isn't it? Please take the floor.
Yeah, thank you. And also thanks for this good question, because assertiveness is very hard because it depends on so many different things, as the personality of the person, the ways they have been raised, and the people they are talking to. I think that we should be taught. For example, to give my example, I was raised by parents for whom parents were always right, teachers were always right, and doctors were always right. So it was very hard to explain to adults when I was a teenager that I was right and that I knew my body and all this stuff. So I think it's not only the patients, it's also the healthcare professionals. I'm sorry, I'm not here to criticize everything, but sometimes, and I'm sorry, often it's hard to be in front of healthcare professionals, whether they are specialists or nurses or like anything, and tell them, no, I know my body, it's not supposed to be this way. There's a protocol. Me, I'm 37, and I think it was 2 months ago, I had a problem in a hospital at the ER department in Ile-de-France, so Paris area. And I was in front of young people telling them that I knew my disease, and I was trying to make them understand the thing. Now I'm 37, so it's fine. I can be assertive. But when it comes to 16, 18, 20 year old teenager or young adult, it's very hard. So of course, we have to give them elements and to make sure they can stand up for themselves. But at some point, healthcare professionals have to learn that the patient know. And if we do not change this perspective, you can have all the assertiveness you have or you want, it will not change anything. So this is a main issue.
Thank you, Jenna. I can see Laura with your hand raised. You can take the floor, Laura.
Thanks for having me here, Maria Angela. It's great to hear everybody speak about their experiences, and all the suggestions were actually very good. Miriam took it out of my mind, communication, which is actually very important. And I also heard Jenna speak about when she was a teenager and she did not care and she did not know, she did not understand her situation. When she was fine, she was fine. When she was in pain, she was in pain. But until after she was 20, that she started to understand sickle cell. My point that I want to raise here is that it's important to recognize, for example, when patients go to hospital, that healthcare providers actually have protocols to follow in regarding to treating patients. So sometimes the healthcare provider is following a particular protocol according to how the patient is presenting. However, if a patient is able to talk, like Miriam suggested, calmly and explain that I have this condition and I'm usually treated this way, very calmly, in many cases, healthcare professionals will listen. Most of them, not everyone will listen, but in many cases, they will listen. Yes, assertiveness can be helpful, but like Jenna said, and also Miriam said, it's quite complicated because when you look at us as African people, people from African origin, we already have that kind of aggressiveness when we speak. So if you're trying to be assertive with a healthcare professional, the tone of your voice or what you say might come out more aggressive than you meant it to be, and the healthcare professional becomes upset because they feel they are right. So it's important to recognize that the communication has to be calm and has to be on a level whereby the patient understands the healthcare professional and the healthcare professional understands the patient so they can work together. It's about integrating that patient and healthcare service provider, partnership to make sure that the treatment for the patient is effective and is of good care or quality care. I also wanted to mention that something came up whereby I can't remember who mentioned that we have to let children know about the condition and about their treatments earlier on. However, we are also forgetting that the stigma surrounding sickle cell disease among families is huge, that you find parents don't want to talk about the condition to their children. So children grow up not even knowing what they have. All they know is I'm sick and I'll go to a hospital, I see this doctor, I get this medication. They don't know why they are taking the medication. They don't know what they have. They grow up and then they reach an age where they have to transition to the adult center and the adult center only deals with the patient directly, not with the parent. And that's when the child starts to learn about their own condition and they get confused, they get overwhelmed, and that's when we lose them, and we lose them between the cracks. So it's important to first educate the parents that this talk about the condition to the child, let the child understand what they are going through, let the child be able to know what treatments they are on and why they have to take those treatments, because in a few years' time, you're not going to be there when that child needs to go and see their specialist on their own. They would have to make their own decisions on what treatments they are on. They have to follow what the doctor tells them, but it will be confusing. Those are just the messages I wanted to deliver. Thank you.
Thank you, Laura. So I see Elvi with your hand raised. You can take the floor.
Hi, everyone. For those who don't know me, I'm Elvi from Germany, former sickle cell patient and president of the Sickle Cell Association of Germany. And during transition in Germany, it's complicated, very complicated. Catastrophe, okay? So just to add what all of you have said, because we have it in common, but Germany is always with everything late and in behind. But since 2 years, we have the universal newborn screening, which means that especially now Germany has to show a difference. So the difference, especially in a transition, because we have never been educated about sickle cell disease. You know, I was born in the 80s in Germany, and my family was lost. So there was no education until now, no education. And Laura also said it, the stigma in the families and the communities is also a big burden. So what we have been told, being born and raised in Germany, was to be very dependent of our doctors, you know, and this dependence also was like is something that we were used to it. So when we are going to the transition, you're dependent in everything what your hospital says, what your doctor said, what the healthcare profession said. And until today, the transition is just horrible. I mean, we have an improvement with the childcare, you know, that's a good point, but the educare, it's horrible. So there's a consortium of doctors in Germany who has developed if I can say, a sickle cell disease companion. I just want to show you this one. I hope you can see it. I mean, with my filter, it's a little bit difficult. No, you can't see it. You can't see it. We have 2 companions, right? Which the doctors have developed. So one companion, because childcare in Germany is, maybe it's also, it's the same in the other European countries. I don't know, because I only lived in Germany. But when a child was born, you know, he has to do usual child treatment at the hospitals from, I don't know, how do we call it? U1 is the babies, and then U5 we have from 2 to 5 years old, and so on. So that's why they developed a companion for especially for sickle cell disease patients from 0 until 17, and then we have a sickle cell companion for adults from 18 until, and so on. Yeah, so I think it's a good step forward to better manage this transition. It's a very good thought, but the problem is the lack of the doctors, the lack of specialized centers, specialized hospitals, healthcare, and so on. And I have a very angry mother here in Germany who's really suffering about this transition with her child, because she was used to go to the same hospital, you know, who treated her child. from beginning on. And when she started with the transition and she was all 18, they transferred her directly to adult care. So the situation in this hospital is that when she gets to the emergency room, there are no doctors, no specialized doctors who know about the disease, but we're talking about the same hospital. So how can it be that in the same hospital where the child was treated very well as a child is being treated very bad as an adult? And I don't know if it's different in other countries, but especially in the emergency rooms in Germany, you're always being treated by assistant doctor. And that's the issue with the assistant doctor. So I have a lot of angry parents here who can't deal with the expertise, or we can say there's no expertise from the assistant doctors because there's no interest for adult sickle cell patients. So this is Germany. So because we have been treated like we need to be dependent of the doctors, you know, the doctors themselves are not ready to think further, to be interested in the adult care for sickle cell disease. So we have this companion, but nobody is taking care of it. But I think with the new universal newborn screening, this is just a beginning, a good beginning. And I really hope for the next 5 years that there will be a bigger improvement. So if we have more, especially parents, also parents who were used to take care of their kids, raise their voice about that, I think there will be a big improvement in the transition, especially in Germany. So this is just a little point I wanted to add, despite of all the testimonies, of course. Thank you.
Thank you very much. Such an important issue raised. So if I follow the order, there is Jenna and then Konsi. So please, Jen, I don't know if it's the previously hand or
No.
if you, okay.
Maybe Konsi should go ahead first because I mean she didn't get a chance.
And just a little. Okay. Hi, everyone. My name is Konsi, and I thank you, Maria Angeli, for having me on this platform as well. So I live in Sweden. So, and thank you, Elvi, for saying what you did just say, because we have the same, at least we used to have the same problem in Sweden. Now things are changing thanks to the immigration that has made it differently. So we have more sickle cell patients. We didn't used to have that many. I could say like the few ones that I met in the hospital were, of course, much younger than me because I'm 50 years now. And when I was 18, that was the first time, actually on my 18th birthday, I had to go to the hospital. And the hospital that I was supposed to move to, because I kind of, here in Sweden, we have different region. Where you live, you have to go to that hospital. So I was living in a different part, and then I moved to the part that I was supposed to go to their hospital. When I got to the hospital, the doctors there said, we can't treat you, and we are not able to take you as a patient. So you have to go back to that hospital they used to treat you. So in all the pain and the crisis, I went alone. I didn't take anyone with me because since I was like 12, 13 years old, I've been reading up a lot on sickle cell. It was very interesting for me because my siblings and my parents, they always said to me, you have this disease and you need to learn, you need to educate yourself about your own disease, because in future, we won't be able to go to the hospital with you. So you need to learn, you really need to read up on it. So I went to the library kind of every day after school just to read on sickle cell. And it wasn't a lot during, say, 80s and 90s. It was not a lot. So one day I decided when I was 22, I actually traveled to UK just to buy books on sickle cell. I got the books and came back to Sweden and kept on studying. What is sickle cell? What should I do? How can I tell my doctors and the hospital or just people around me to understand what I'm going through daily? Even the same with the sibling, they couldn't understand. They just saw me in pain, or I was upstanding one day, and the next day I had to ask them, they had to take me to the toilet or whatever. So it was difficult. But what Elvi said, that the doctor, they don't know, actually I'm not saying, I shouldn't even say, but they didn't have a clue on how to treat me or the other patient. So now we have, it took time before we got an association that I started in 2015. But before that, we had nothing. So and even in the hospital, the doctors were saying, you are the only sickle cell patient. We don't have sickle cell patient in Sweden. This is what the information every sickle cell patient got. And it's a kind of, for me, as a sickle cell patient, hearing that, it's really painful, because I knew that in my head, it was, it cannot only be me having this disease. It should be someone else. And Sweden is a very huge country. So I asked, and then I got a doctor. He was from Iceland. And then he said, it's not only you, that at least I have 5 patients. Then I said, okay, what can we do to just meet? And then he said, I can't bring you guys together, but someone has to start something. Then you can meet the rest of the team, which I did. And it was really, really fun, because then we realized that when you come to the emergency, you only meet the student doctors, and they don't know anything about sickle cell. The main, specialists, they are not in the emergency room. So you get treated badly only because they can't treat you. They give you like paracetamol, and what Laura said, you need to be able to speak nicely. When you are in a crisis, I'm sorry, you can't speak nicely. You just want the pain to get over. And the only thing at least what you have been taught from the doctors, is this painkiller, I mean, like for morphine, will help you. And even today, when I go to the hospital and talk with the nurses, they say, yeah, but most of the sickle cell patients, they have medication at home. So why don't they just take the medicine and then they'll be fine? And trying to explain to a person who doesn't know anything about sickle cell, saying the thing is, every sickle cell patient has already tried everything at home and it's not working. So we are just coming into the hospital to just kill that feeling that you don't want to die. That's why you come in. If we could treat ourselves, I can assure you nobody will come to the hospital. So it's a lot of miscommunication. And at the same time, you have parents who doesn't want to talk to their children about the disease, which is really, really bad. But it's communication. But at the same time, I feel like as a sickle cell patient, I know my body. That's the problem. I know my body really, really well, and I know what works and what doesn't work. That is one that, because I've been reading a lot on sickle cell, and I know there are a lot of people who just feel like I don't want to know the disease. Yes, of course I have it, but I don't want to care about it. Those are the kind of patient I like to talk to. I like to invite to my home and sit down, explain to them and say, when you know your disease, is much easier for you when you go to the emergency or when you meet people, and you can explain to them and say, I have this and this is how it works for me. But if you sit in your darkness, or if you sit quiet and you don't express what you feel, that's a big problem. So I'm not going to go on more because I'm taking so much time. Sorry. Thank you.
Thank you, Nancy. So, Benoit, did you want to? Sorry, I saw it. in a wrong way. So Diana, you can go if you want.
Yeah, I just wanted to answer to what Laura said about the disease. The thing is that I guess all of the healthcare professionals will agree with that. Every kid, every teenager, every patient is different. So me, I remember that I didn't realize the impact of sickle cell disease. So I was kind of dreaming, but dreaming is good. So I'm happy I didn't have a doctor who told me, no, you cannot do this, that, because maybe I would not have done anything. So I think that each patient is different, and we cannot have some kind of protocol where you make the kid sit and tell him you cannot do this or that. Just let the people live, and we'll see what they do or what they don't do. That's it.
Thank you. Laetitia? I can see your hand raised, Letitia or Laetitia. I don't know how to pronounce in which language your name, or maybe it's what I will try to do like this.
Yes, this is Laetitia from Derepacare, but she's hospitalized for a crisis at the time,
okay, so
and
maybe
perhaps she doesn't want to.
Yeah, sorry.
Laetitia,
Maybe...
are you here?
Yeah, I'm okay. I'm okay. Okay, I'm Laetitia. I'm a sickle cell patient. I'm 30 years old, and I did the expert patient and TPE training. Yeah, I'm part of the Derepacare organization. For me, I went to the adult hospital for my first time when I was 15, and it was horrible. The staff didn't know the disease and the protocol. I wait 7 hours each time in the emergency room before they take care of me, and I end up in intensive care each time. And because of that, as soon as I got my diploma, my baccalaureate, I left this city to avoid dying. And now we create Derepacare with my friends. It's a mobile app to help patients better manage their disease. They can write down their pain, their treatment, chat with other patients to share their life experience, chat with parents, students, yeah. And they have digital vaccination record, digital emergency card with their information. Is this? And like Dora, like this, I'm sorry, I'm currently hospitalized and I'm eating, sorry.
Thank you very much.
Can they see me? You see me or not?
We can hear you, not seeing you.
Oh, okay.
No.
Oh. Okay.
But we hear you.
We hear you, yes.
Okay. And that for me. Sorry.
Okay, great. Thank you very much. So I know our time has run already. I will just read some comment quickly in the chat and maybe having a quick round table for conclusion. So seeing in the chat, there were the mentioned by Laura, the crucial role of patients' organizations, role in education, not only for patients, but also for professionals. And also there were the key point of communication, and also a comment done by Dora on some application on the mobile phone that help in collecting the patients' reports on report on the follow-up of their disease. And indeed, this is one of the topics we are going to develop with our ELN, the patient-reported outcomes tools. So those are tools that report the point of view of patients within the research, within the clinical experience, or within the education. And it's a way for matching the point of view of patient that is a singular experience within the science that is more wide and more general. So we are for sure going to talk about it and see it together. So as a roundtable, after having collected all these suggestions and all those ideas, and as said before, also we like to bring all those ideas in a more practical session for teenager next year. So we have 1 year for organizing ourselves. And I wish to have all of you in this upcoming project we can think together. So I was thinking about some automatism we all have in our communication or in our practice. And so maybe one way of thinking about communication between patients and professionals is to work on those automatism. Like Jenna was mentioning, the idea that we grow up with, that parents, teachers, and doctors are always right. So this is a kind of automatism. We have to think that this is this way. We can work on it to feel more comfortable in raising our thoughts, idea, or feeling at our place that we can have one truth to speak. Also, for instance, listening to you, I was thinking about the scene, and this is more for Benoit and Dora. The automatism some doctors have and some other not, when they are speaking to young adult patients, not to tell to the parents to leave the room for speaking to the patients. And this is something simple, but it's an automatism. It could be a good one if practiced, or not a good one, because this is also a way not only for making the patients feeling comfortable, but also to force in a nice way to express himself or herself. It is a way for recognize the singularity of the patients, I think. From my humble point of view, I'm not a healthcare professional, I'm not a psychologist, so just running idea, listening to all of you. So I don't know if Benoit and Dora want to comment just for closing comments, because we are late. I'm sorry, I'm taking you here. Thank you.
I think it's a very important point that you raised. Me as an adult doctor, it's true that I always speak to the adult, and even if it's a young person, for me it's normal to talk directly to the teenager or the young adult. And sometimes when the parents still come to the consultation, I say, okay, I ask the young adult or the kid, do you want your parent to come with us in the room? And if the parent, do you agree if your parents come with you in the room? And then at the end or in the middle of the consultation in general, I ask the parents to leave the room, and I make the end of the consultation. So for me, it's kind of natural, but in general, when we raise questions about how sickle cell patients are facing problems in the emergency department or in other departments, it's true that we don't recognize our own practices because we are working all day long with sickle cell patients. So, I mean, I don't think we are representative of other healthcare professionals because we are already aware about this. So our mission and what we do is that we go to meet the doctors in the emergency. We train other doctors that can meet sickle cell patients to raise awareness about these issues. It's our part of the job, but
I
don't know if I'm
agree
clear, but...
completely with Benoit, and I would say also that patients have to share their experience and to say to tell to the doctor that they are not. The pain is not well treated, and so it's very important. They say it's not possible to leave me like that, and so I wonder if for Sweden and Germany and which are countries in Europe, how do we can improve the knowledge on sickle cell disease, because it's not tolerable.
But I think it's the same in France. And when we are asking, or when they make the programs for medical students, sickle cell disease is quite often as disease like lupus. And lupus is one of the main topics. You hear about lupus all the medical school. It's in every exam, every test, everything about lupus. And we have the same number of patients who has sickle cell disease and lupus in France. And you have for sickle cell disease maybe 10 lines, in the big anemia chapter. And I know that there is some work done to ask the deans, I don't know, like the people who make the programs to integrate more sickle cell disease, but still, so far it's not a reality. And it's really very hard to make those things change. And it's true that it depends. The doctors, they know the disease when they are working in some regions, especially in Paris region, but it also can be in Marseille or in the Caribbean islands, where they are the patients. But when you go anywhere else in France, they don't know, and it's hard to blame also.
But it improves with
but it's getting better. That's true.
But I think patients associations, and we need to have these testimonies to improve and to say it's not possible to be so ignore sickle cell disease.
Yes, indeed, as was said in the chat by Jenna, advocacy at the European level,
yes.
What we are also doing here today should be the priority. So Laura, the really last comment, so we can close the session. Take the floor.
No, I just want to comment on what Dora said. How can it be improved? The example that I would give is in Ireland, we had the similar problem, and advocacy as an organization played a huge role advocating to policymakers on changing the curriculum for medical students so that sickle cell disease and thalassemia can be integrated into the school curriculum. However, that takes time, and we haven't got any response to that. But what, as an organization, we've done, we've actually created our own educational package whereby we go to these universities and do the lectures. So the lecturer will invite the organization to come and teach about sickle cell, and then we take patients, a patient or two, to share their patient experience, because students learn more from when they hear from a patient and they can ask the patient the question. And sometimes we partner with a clinician. We could take Dr. Corina McMahon from the pediatrics, because she's the lead pediatric consultant, or we could take a clinical nurse specialist from the adult section to go and give the scientific lecture of the whole condition. We as an organization give the support lecture, whereby how do we engage with patients on a community level, on a supportive level, on an advocacy level, and then the patient gives their own part of what they are going through, how difficult it is, and people ask them questions. This has worked very well over the years, and it has improved the knowledge about sickle cell disease, that a lot of patients are not struggling as bad as they were before. we've also done that with the ambulance services, because sometimes when a patient is having a crisis at home, they will call the ambulance service, and the ambulance men do not know how to deal with a sickle cell patient in a crisis. So we have done the same. We have a pre-hospital emergency care kind of education that we provide to the ambulance services. And every year that when they are training their own new ambulance personnel, they invite us to give that lecture. So twice a year. So I think that would be able to help.
I completely agree with you. Thank you.
Thank you.
Thank you, Laura. So thank you for the nice feedback in the chat also. As said, it is really my hope, and I will do my best to follow with this topic, also with the group of today. So all your feedback will be taken into consideration. Thank you very much. This is very precious. So little moment of publicity. So tomorrow at the same time, we are going to talk about aging well. Then on Monday next week, not in the ASCAT, but in the framework of a webinar program, so it's shorter and it's only EuroBloodNet, we are going to talk about infertility after bone marrow transplant. And we came back with this format on the Tuesday with the topic as embryonal selection, genetic counseling for fertility, neonatal implantation. So I hope to see all of you also on the following day. Thank you very much for the speakers, the testimonies, and all of you. This has been very nourishing and fruitful. Thank you very much. I really learned a lot today. Thank you.
Thank you. Bye.
Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye. Thank you.